Hi folks, it's Phil Russo here and welcome to another episode of Infection Control Matters. And today I'm joined by Dr. Gemma Saravanos. And Gemma has that lovely and very marketable combination of being an epidemiologist and a registered nurse. So welcome, Gemma.
Thank you, Phil. Happy to be here.
So Gemma, you are at the University of Sydney and you're also a postdoc at Sydney Children's Hospital Network. And earlier this year, you were the lead of an article, a commentary, titled Infection Prevention and Control Program Priorities for Sustainable Health and Environmental Systems, which was published in BMC Global and Public Health. Gemma, it caught my eye because I feel as though I'm very much a dinosaur in this space. The terms of sustainability, environmental issues and climate change and goals and all that sort of stuff are being used more regularly now. And I hear about the importance of it in healthcare and the significance of it. And your article talks about it and what infection prevention and control influence has in this space. So I wonder if you could we'll talk about your article, but perhaps just give us a few definitions of some of those terms that we use.
Yeah, absolutely. And look, Phil, acknowledge what you're saying. And I think, we're all learning in this space. So I'm absolutely learning as well. And I guess maybe good to start with just a bit of a, conceptually the problem that why this is important. So I think, when we think about climate change, it's really up there with antimicrobial resistance as one of the greatest threats to human health. I think as IPC professionals, we know a lot about antimicrobial resistance, and we do need to learn more about climate health and how we can have an impact there. Healthcare, including infection prevention and control, of course, has a really big environmental impact. In Australia, healthcare is responsible for around 7% of all greenhouse gas emissions. And mostly this is coming from hospitals, closely followed by pharmaceuticals.
And so in your article, perhaps you could tell us a little bit about what you wrote. And you make 3 high-level recommendations in this article. So perhaps you could expand a little bit on those.
Yeah, absolutely. So I guess this article, to talk briefly about how it came about, and really it was inspired by attendance at a SIPC conference a couple of years ago, when we're starting to see this conversation around sustainability emergence connection to IPC. And we do often hear a lot of that conversation being, IPC is the enemy of sustainability, where you have all of this PPE, and that's really important. But I wanted to sort of, I guess, take a bit of a higher level perspective, look at the big picture and see where IPC fits. So we've really made these high level recommendations and really a call to action for IPC and for health systems and health professionals as well. And these are to strengthen the evidence base of IPC, measure and mitigate our practices and procedures to ensure that we are reducing environmental impact where it's safe to do so, and really importantly, harnessing the power of human behaviour. So like IPC, sustainability is everybody's business, and we really need to have everybody taking action and doing their bit to make sure that our systems are sustainable.
Sure. Well, one of the areas that you mentioned in the article is to try and minimise low-value care. And this is also related to the fact that a lot of infection control recommendations aren't based on strong evidence. And so it's and for lots of reasons, we don't have strong evidence, but that sort of lends itself to maybe poor practice creeping in or doing things where we don't have any good evidence and doing things that are low value. So give us an example of sort of the low value activities that you think are there.
Yeah, and look, I think it's great to see research happening in this space. And one of the examples we used in the article was talking about single-use gloves and gowns and that low certainty of evidence for reducing the transmission of MRSA and VRE. And so there is actually a lot of observational evidence out there to suggest that this is low value, but we don't have that hard evidence, such as a randomised controlled trial to really drive that change at the moment. However, there is, great work going on in this space.
Yeah, we are starting to see some randomised control trials in infection prevention and probably got Australia's own Brett Mitchell to thank for that. Brett's setting up quite a few RCTs at the moment, which is fantastic. So, Gemma, perhaps you can take us back a little bit and talk about sustainability and what defines sustainability, particularly in relation to healthcare, I guess.
Yeah, absolutely. So look, a general definition of sustainability is really the use of resources in a way that ensures their availability over time and for future generations. When we talk about health system sustainability, what we're interested in is ensuring that our health services are effective and efficient. So often we will hear that term evidence-based. We're interested in reducing waste of our healthcare services and systems. Increasingly, we're hearing about having low carbon health systems, and we have, increasingly we have these net zero targets, so reducing greenhouse gas emissions. And another really important thing is the resilience against threats. So we need health services that are resilient against the threat of climate change, increasing temperatures and increasing natural disasters as well.
So it's really big picture stuff, and some of us perhaps don't appreciate the impact on infectious diseases that the climate change and environmental issues will have. But it's certainly, I guess, my understanding is that even the smallest of changes in those spaces can have a big impact for everybody.
Yeah, absolutely. And look, you've touched on so many intersections with this. Are really difficult in this commentary to keep it under 1,000 words. It's quite short. And look, one thing that I did really want to highlight was that actually our article, I think for IPC, is a good news story. And what we wanted to really say was that good IPC practice is really fundamental to achieving sustainable health systems.
So one of the things that struck me on this issue, I guess, was when I was working in quarantine hotels in Victoria, and I'm sad to say it was probably a lot to blame for a lot of the waste, because for a fair while, everybody in the hotels across the system were required to have full PPE. And at the end of the day, I used to see the industrial waste bins get taken away, and it was just huge bin after bin of PPE. It was probably only worn once. Should have only been worn once, and been taken away for disposal. So and you talked about that in the article. You're still using gowns and gloves, probably not always at the correct time, and that's contributing to a lot of the waste. Another study that caught my eye earlier this year was a paper by Melissa Rochon, who did a study looking at post-discharge surgical site surveillance. And with that study, they also measured the carbon footprint of surgical site infections, and I think they had a little calculator that that was able to estimate the carbon footprint of their study outcome. Is this a sort of thing as researchers that we should also be looking at the carbon footprint of what our interventions?
Yeah, absolutely. And that second point that we make in the article about measuring and mitigating, we really do need to have a good handle of what the carbon footprint of our practices, of our programs are, and so that we can actually work to mitigate that. And look, I think, you mentioned the example with COVID. I think it was a real, a bit of a wake-up call in the way that the management of healthcare waste was really challenging during COVID. So we had overwhelmed waste management systems. And then we also had a lot of inequity. So we had people who couldn't necessarily access the PPE, the masks and things that they needed. So there was sort of a lot of issues going on there, and really made us step back and think, are we managing our resources in the way that are actually most effective to prevent infections?
I guess that makes me think that one of the big challenges that we've got, I guess, is that not all countries are well equipped to be able to put systems in place for sustainability. So how do we approach that issue?
Yeah, look, it's a big question. And one of the reasons with this article we actually took quite a global perspective, and it's published in an open access journal as well. We had a number of experts in global health as well as infection prevention and control on this paper. And look, I think certainly there's very much we can do on the ground as IPC professionals or nurses or health, other health professionals, but it really does need to be underpinned by good governance and leadership.
So, Gemma, from a IPC point of view, working in a hospital and IPC teams, what sort of things should they be doing, or what sort of things should they be planning for good, sustainable IPC programs?
Yeah, good question. And so the first thing I guess I just wanted to make is remake that point that IPC is fundamental for achieving sustainable health systems. When we do good infection prevention and control, we prevent infections and we prevent that downstream social, economic, and environmental impact. So that's the first thing. So I think we should keep doing what we're doing, and doing that good work in preventing infections. Advocate for increased investment in IPC practice, surveillance, and research. This is going to help us build that evidence base. This is really important. We need to also evaluate IPC programs and include a sustainability lens. And connecting to that is we really need to be out there engaging with our communities. So, we've got sustainability teams at hospitals now. So IPC needs to build those relationships there, have a seat at the table there, as well as working, outside with our other health services. Immunisation is really important. Wider community and industry as well, so we can really build those connections and innovate our programs to make sure that they are evidence-based as well as being sustainable.
I think one of the lessons the IPC community has learnt since COVID is the requirement to broaden the professional angles that we bring into the IPC. And we need to, consult the OHS, we need to have engineers and all that sort of stuff. And now I think we need to have people with expertise in sustainability. And hospitals would be making those appointments. Is that what you're seeing?
Yeah, absolutely. So this is certainly emerging within the hospital. We have, quite large sustainability teams, a lot of nurses. Hopefully there's some IPC professionals already engaged with these teams in our hospitals. But look, those relationships and that people power, as we speak to in the article, we really need to enable and empower people to do the work and to make things better in our systems.
Well, that's great, Gemma. So we'll finish up there. Thank you very much for your time. It's a really good article. I think it's a really good starting point for a lot of us who are trying to understand where we all fit in the sustainability with IPC. So congratulations on the publication, and thanks for chatting, and let's hope for more sustainable health systems in the future.
Thanks so much, Phil.